and welcome back to Chiropractically Speaking, the podcast. I'm Dr. Prathap Addageethala. You can call me Dr. Pratt. And in today's episode, we are going to be digging into the tools of the trade of chiropractic. In previous episodes, I've mentioned that chiropractors have over 200 techniques available to them. That's a lot of techniques. But how do you decide which one is the best one and which one do you need in your hour of need? So the truth of the matter is there's a lot of variation in between these particular techniques, but all of them are derived at doing the same thing. And that is alleviating your discomfort, improving your range of motion, improving your neurological output, in the sense that we're opening and improving the signal going from brain to body. That is the central theme for chiropractic care. And that's something that's very, very evident in all versions of chiropractic and all techniques involved with chiropractic. So without further ado, let's dig right into the tools of the trade. The first technique that we're going to be discussing today is diversified chiropractic treatment or diversified technique. Diversified basically encompasses a bunch of different techniques related to joint manipulation, whether that's related to the spine, to the peripheral joints, arms and legs. It's related to joints that are typical or joints that are involved in pain or joints that are going to be involved in other elements of your health. Diversified covers a whole group of them, hence diversified. Therefore, most chiropractors use diversified in some way, and this is the one that you're most used to seeing. Now, let me put out a disclaimer of sorts. Chiropractic is not exclusive to joint manipulation. There's a lot of techniques out there that don't involve any manipulation at all. There's no, in some cases, not even any contact. I won't be covering that one because I'm not really quite sure about it, but these are techniques that are available. When we're talking about chiropractic adjustments and spinal manipulation specifically, a lot of other professions in the world historically have used spinal manipulation. So we don't have a monopoly on spinal manipulation. If you're an osteopath, for example, or if you're a bone setter, for example, a lot of what those professions do looks really similar to what a chiropractor would do. There are some very, very clear and obvious ways that chiropractic is different. But one of the major realities about the different types of techniques and the differences between different disciplines is the philosophy on why is that joint moving? So in chiropractic care, a lot of ways we describe the care is it's an art, a science, and a philosophy. So the philosophy is really what makes chiropractic separate and distinct. If we were to boil it down to just the mechanical methodology, it can look very similar to other professions, but that's where we differ in terms of the philosophy. Now, when it comes to the art, that's what makes every individual chiropractor unique. This is also the argument that medical science has with chiropractic care. The same art, the same ability for each practitioner to impart their magic, their art, their ability to perform the adjustment on a patient is what we call intra-examiner unreliability. That's why medical doctors or people in the medical establishment believe that chiropractic care is not scientific, because one of the rules of doing good science is that it should be replicable. Now, I'm about 5'10", and I won't tell you my weight, but the idea is that if somebody is 6'5" or 5'1", are they going to be able to do the same adjustments that I do? Or in the opposite, am I going to be able to do the adjustments that they do? The answer is probably not. The physics of it won't work out. Even if I have a twin who has exactly the same DNA as I do and has gone through the exact same schooling and training and everything that I've gone through, our experiences of the world are going to be different to some degree. And that degree of change is going to change our perception on how we're going to be delivering the adjustment. Now, if that is enough to make the adjustment different, then guess what? We have low inter-practitioner reliability, and that makes us unscientific. But I'll take it. If that's what makes us unscientific, I'll take it, because I know that between the science, the art, and the philosophy, we have something here that nobody else can do, and nobody can do as well. So let's get back on track here. Diversified adjusting is really simple. It involves a high velocity, low amplitude thrust. That's an HVLA thrust for those of you alphabetic people at home. HVLA is a methodology of a unique way of moving a joint. It involves a quick but specific push onto a joint, or a quick and specific pull on a specific joint with a very low amount of distance that joint travels, hence low amplitude. These are technicalities of what we do, but the most common thing that people will notice from these particular adjustments is that pop. Some people find it satisfying, some people find it terrifying, and everything in between. And as we've covered in previous posts and Instagram videos, the pop is actually coming from a gas that is dissolved in a fluid that bathes the joint. Now, some people believe that it's the formation of a bubble within that fluid, and some people believe it's the actual popping of that bubble and that release of gas that causes that cracking sound. Now, whatever way you believe it, it's the same thing. The formation of that gas is actually just the gas coming out of solution of synovial fluid. Synovial fluid is actually one of the most slippery substances on earth. It's actually more slippery than Teflon, which is pretty cool. And that is what bathes all of our joints in our body. Some joints have less synovial fluid, and as a result, they're a little bit less mobile. But the idea behind chiropractic care is to adjust, or HVLA, or diversified adjust these particular segments to increase the amount of fluid that is bathing the joint and to allow that joint to become unrestricted. By doing these chiropractic adjustments, we also enable ourselves to take pressure off of nerves. Nerves usually, the nerve roots exit from our spinal cord, and there's a special space for them to come out of. When a joint is restricted, it is possible that the space that nerve comes out of is compressed or reduced a little bit. And therefore, the signal that nerve is supposed to be sending out to the muscles or the joints or the organs can be compromised to some degree. So by restoring good joint motion at that location, we're actually improving the signal going through that nerve to its end organ. And that's another reason why chiropractic care has been researched to be very effective in a lot of different types of conditions. One of the most interesting versions of diversified care is of the much ballyhooed technique called Gonstead. Gonstead technique has been getting tons and tons and tons of attention online because of definitely some very talented doctors out there, but also their mega machine marketing videos that they've put out on YouTube and Instagram. No shade here, no shade thrown. Gonstead has been, from the very beginning of Gonstead technique, starting with Clarence Gonstead, the father of the technique, it's been going strong since then. People have been getting tons and tons of relief from Gonstead practitioners. And remember, Gonstead technique is just a variation of diversified. It is still involving HVLA technique. However, it's a very, very specific version of that. Gonstead technique is known to be really ultra specific. Gonstead practitioners tend to x-ray their patients and review x-rays very, very systematically. The listing process, in other words, the notifications, how these doctors put down notes in their various patient files, is also very unique. It's specific to the technique. It's very technical. And for people who are non-Gonstead practitioners, it's very intense. I myself don't practice Gonstead technique, but we do have a practitioner in one of our Bangalore locations, our HSR branch, Dr. Remy Koenig. He is a Gonstead practitioner. He'll always say that he's not a Gonstead practitioner because he hasn't done the exams and he hasn't gone through the entire coursework, but he is, by every ounce of the word, a Gonstead practitioner. I always call him a technician. He's a tactician, where I'm a very generalized chiropractor where I can recognize joint motion issues. I can recognize where a muscle might be tight. I can recognize global issues, and I can diagnose pretty accurately. In his case, when he's tackling a particular person's issue, it's very ultra specific. How he does it, his methodology is extremely, extremely precise. And I genuinely wish that I could develop skills towards becoming as precise. So that is something that it's a huge praise. And I think that there's a reason why Gonstead is becoming so popular online. And a lot of people call in or message or email us saying, can we get Gonstead chiropractic treatment from you guys? And the answer is yes, you can, but not from every practitioner. The other thing is that, especially for some of the more popular videos online on Gonstead technique, there is a little gadget that they use to kind of measure the spine in some way. That is a nervoscope, and we do have one of those. Dr. Remy uses that regularly, and it's based on understanding the surface EMG of the joints in the spine. It's really highly technical, and it's just ultimately one more way that we can be very specific on what joints to move. Gonstead practitioners are also really picky on which joints they adjust. Their goal is to adjust the joints that are the most involved in any pain issue. So if your Gonstead practitioner chooses a handful of joints and doesn't adjust everything, that's a good thing. You want that. That's the Gonstead process. The next technique that I want to talk about is called flexion distraction. Flexion distraction is using a very, very specific tool. It's a table that's equipped specifically for this particular technique. In this particular technique, the main objective is to open up space for disc patients and for stenosis patients. Basically, people who are experiencing compression near or at the spinal cord regarding tightness in joints and regarding disc bulges. So if someone is experiencing one of these conditions, they would typically lay into the table, which has a breakaway piece in the middle. The middle of the table actually folds away while their feet remain anchored. If anybody has ever been on an inversion table before, they understand that if we can reverse the effect of gravity, it would help to elongate us rather than to compress us. Gravity works obviously by keeping us tethered to the ground, right? That's how gravity works. If we were to, hang upside down, you can understand how our spine would expand, just again, based on gravity. So what this particular machine is aiming to do is by having us go face down and allowing our body to bend from the middle, it helps to open up space where the disc can easily go back, especially if it's protruded out, putting pressure on a nerve. You may want to go back to our episode on spinal anatomy before, if any of this is kind of confusing, it'll be a really great review for you to understand like what specifically we're working on and what each condition that we're treating would help with, and how each technique is very specific to particular conditions. So if you want to go back and watch that or listen to that episode, just click over there. The nice thing about flexion distraction is that we can really easily establish a smooth rhythm. Many flexion distraction patients who utilize this technique often don't need to be adjusted or cracked in any shape or form. It's usually the end of the treatment once the flexion distraction maneuvers have been done. So for anybody who's not interested in getting cracked, but looking for relief from disc issues and stenosis, this is one of the greatest ways to do it. I've actually benefited a lot from this treatment, and we're still working on getting this into our centers here at Atlas, but it is going to happen very soon. Now, soft tissue therapy is something that's very special to me. I love soft tissue therapy. In fact, in college, I spent so much time learning all of the soft tissue techniques that were available at the time. I consider myself a soft tissue expert. It involves a little bit more care than the average crack and pop, but the idea here is that the muscles are a significant component of our anatomy. We are neuromusculoskeletal specialists, which means that we work on the nerves, we work on the muscles, and we work on the spine. So ultimately, when it comes to muscles have referral patterns, and they can get tight based on any number of things. You don't move enough, your muscles can get tight. You move too much, your muscles could get tight. You're working out, you're doing everything properly, your muscles could get tight. So what gives, right? That's why it's really important to get into a routine of maintenance for your muscles, whether it's massage or acupuncture or cupping or chiropractic care. It's a really good idea to make sure that your muscles are getting the much needed treatment that they deserve. So soft tissue work is something that chiropractors are really, really good at. It makes a lot of sense to add a soft tissue element to your chiropractic plan. We often use physiotherapy as a modality with our treatment plans so that we can establish good movement patterns on the muscles as well. Soft tissue treatment usually involves trigger point release. Muscles have fibers. If there are non-vegetarian people in the audience, you'll know that if you've ever cut meat, you'll notice that there are fibers that run in particular directions. And if you cut against the grain, it looks a certain way. And if you cut with the grain, it looks a certain way. So fibers in muscles are supposed to run in particular patterns. Sometimes what happens is within the fibers, they tend to get a little misaligned or rearranged. And when that happens, the fibers don't slide over each other well. If the muscle fibers slide over each other well, then the muscle can contract and relax easily. Sometimes when there's a bit of a hitch, there's a bit of a grouping of these fibers because they're not flowing in the same direction. That's what causes a muscle knot. And then that causes its own discomfort. So from that discomfort, there can be neurological compromises that are called referral patterns. And it can cross over from one side of the body to the other. It can go from one part of the body to another. So it can start in your neck and go down to your shoulder, et cetera, et cetera, et cetera. So we want to make sure that your muscles are always in good operating condition, and we're working on things a lot. Here's another thing. Trigger points are not always an issue. It's not feasible to get rid of all of your trigger points before you start therapy or before you start another endeavor, like a new sport or something like that. I hear this a lot. Patients usually come in and they say, oh, my physio told me that I can't start exercise until all the trigger points are gone. It's not something that we can realistically expect. Trigger points will come and go. The ones that stick around the longest are obviously the chronic ones, and those are the ones that we should be treating. But expecting them all to be gone before we start something new, that's a lot of work, and that's not really feasible. We should be able to work in a way where even if there is some minor discomfort here and there, we should be able to work through it. That's the whole point of rehab. Again, I've said this before, but one of my favorite people to follow in this space is Dr. Craig Liebenson. And Dr. Craig basically says, rehab is the ability to move in the presence of pain. That's what rehab is. So it's not that you need to be completely pain-free before you start something. That's a fool's errand. Don't get into that. You should be functional before you get started. And then you monitor your symptoms. Do the hardest thing you can do well often. Let me repeat that. Do the hardest thing you can do well often. And that's how you improve. The next technique that we use often is something called the activator. The activator has many spin-offs. There's a lot of different products that are basically just like the activator. The activator itself has gone through many, many changes over the years. But the activator basically took care of one of the major issues that chiropractic care had, and that was the inter-practitioner unreliability issue that we spoke about before. To recap, two chiropractors who adjust the same joint may adjust it differently based on their world experiences, et cetera, even if they use the same technique. So the activator aimed to take that away from the equation. How did they do this? They created a tool, and for the people who are on YouTube, you're going to be seeing what the tool looks like. The activator was an instrument that was created with almost the same kind of spring-loaded technology that a pistol has. So it basically preloads a tension in the spring that when the practitioner squeezes the trigger, it releases a small amount of pressure through a head. And it looks very much like a stove lighter here in India. It sounds a lot like a stove lighter here in India. And the major function is that the head of this tool applies a light amount of pressure onto a joint, allowing it to move a really, really tiny amount. Now, there are protocols on how to adjust properly with the activator. There's a neurological protocol. A lot of chiropractors end up using the activator for smaller joints that they don't want to put a lot of pressure through. I like to look at this like a statue. If I'm a sculptor and I'm going to make a statue, okay, first of all, there's a big chunk of stone, but I can choose to use a big hammer and a big chisel and take off big chunks of stone, or I can use a smaller chisel and a smaller hammer to be very fine and make a smaller detail. So that's what the activator allows us to do. It allows us to be very fine with our movements, because a lot of what chiropractic cares about is about moving joints. So if we're able to move with a higher degree of specificity, a higher degree of care, a higher degree of, caution, then it might make the joint movement a little bit easier. I know practitioners who have made their careers on only activated. They do no cracking adjustments. It's all just activated, and they get stellar results. So there is definite research behind activated. In fact, chiropractic research really skyrocketed after the activator was created because it had eliminated that interreliability issue. I use the activator from time to time. It is a really great tool to have around the office. It's not a primary tool that I use, but it is something that can be used. So even if that's the primary methodology from a chiropractor, it can still be very, very effective. It is one of the techniques that has the most amount of research behind it. It is a respected tool in the profession. We have another technique that we use. It's called the Thompson drop table. This is also known as a gravity assist. Now, in some clinics, depending on the technology and the tables that they use, some of these gravity assists can be activated by a foot pedal. In our clinics, we have the more basic tables where we have handles that lift up and down. Now, you may have seen me using these in my videos and probably wondered what the heck that is. This particular drop feature is usually a feature of the table that we use. That's why chiropractic care is very specific. We actually have tables that are designed for our work. So it's a small element of the table that can pop up at a particular angle and at a particular height, and it can be set with tension. Now, when the patient's body is positioned properly on this drop piece, the practitioner can apply pressure in different angles with different amounts of force, and the table's tension then snaps, allowing that drop piece to go from maybe an inch and a half up to a flat position. That has the ability of moving joints very, very gently as well. So as we talked about with the activator, moving joints with a smaller chisel and a smaller hammer, this is what we are looking at with the drop table. After we adjust patients, a lot of chiropractors will look at leg length, or they'll start with leg length and understand where the pelvis is sitting. A lot of chiropractors will then adjust the leg length using the drop table by lifting the table up several times and pressing down to create movement at the pelvis. I use this often to correct leg length as well. It's very effective, it's very simple, and it's a very great way to fine-tune an adjustment. In certain cases, for people who cannot tolerate the diversified adjustment for lumbar spine, which I use, which are basically side posture adjustments where I lie the patient on their side and turn them slightly. For patients who can't tolerate that, the drop tables are a really great substitute. It's a great option for patients who just do not tolerate that side posture. So the drop table can also be used for things outside of joints, like even abdominal adjusting. It can be used to help mobilize. It can be used to help to open up space. So it doesn't always have to be thorough joint movement. It can also help with these things. The other thing about the activator as well as the drop table is that it doesn't have to click. In fact, most of the time when we're using this particular technique, it won't click. So a lot of people, after I do that, they're like, did that even do anything? And the answer is yes. As we had mentioned before, the crack isn't required for movement to have happened. Movement is the goal. We want to change things. So if the movement is happening through the drop table or through the activator, even if you're not hearing the click, we are getting movement. Lastly, I wanted to touch on a couple of fad adjustments. Okay, you might have seen these videos out there. First of all, if you see anybody swinging a hammer and actually hitting somebody with a chisel, don't go there. They're not chiropractors. Okay, we don't do that. I know there was a person who was doing that before from, I think it was, he was wildly popular. It wasn't somebody sitting on a mat. It wasn't somebody. It wasn't like that. So anyway, if you see somebody swinging a hammer and hitting people with a chisel, I would not recommend going there. I don't think it's a useful technique. Then again, It's certainly not a chiropractic technique. Let me put it out there that way. Another one that we see often is something called the ring dinger. This happens to people who get a towel wrapped around their neck and getting their head pulled up from the towel. These people are usually positioned on a particular table. There are these snug posts that fit over their hips that helps to keep them in place while the neck is being distracted in a vertical position. Now, that has been shown to improve people's health. I know there's a lot of videos that people are like, wow, 15 years of pain gone in a second. This is not for everybody. And its cousin, the ring dinger's cousin, is the Y strap. Now, that's a really popular one too. People often ask, hey, aren't you going to do the Y strap for me? And the answer is no. Not every person is going to be requiring the Y strap, and not every person needs the Y strap. The other thing is, in some cases, the Y strap is actually not beneficial. In fact, it could make things worse. So I don't recommend the Y strap for everybody. In fact, recent research is showing that it could cause some strain on some arteries in the neck. I'm not going to do it for everybody, but some practitioners make a business on it. So it really depends. Anyway, the main factor on these particular adjustments involve the vertical release of the spine. If you can imagine, if somebody's sitting all day, they are going to get compressed. We talked about gravity and the way gravity affects our spine. This compression is only really going to get better if we can do something to decompress. And what the Y strap aims to do is decompress vertically by pulling with a certain amount of specificity and a certain amount of velocity from the neck all the way down the spine. So those are some options you have for techniques. So again, this is just a nutshell. I covered, I think, 5 or 6 different techniques, and we have 200 to go. You know what I mean? So there are tons and tons of techniques that chiropractors do use. There's always a combination of things that we use. I use all of these techniques on a day-to-day basis in my clinic. My practitioners that work with me are also using them cyclically. Some people are more inclined to use certain techniques than others. It's all good because we're experts at finding the right tools for the right job. Ultimately, leave the care to us. Let us decide what to use. This is not McDonald's. It's not Burger King. You can't come in and say, I want this, this, and this. You can request it. We can consider it. If it makes sense for you, we'll do it. But if it's not in the cards, if it's not something that we're wanting to do, then our wishes are going to go first. We're going to give you what you need more than what you want. Just get used to that. That's something that is actually a credit to chiropractic and not a detractor. So just so you know. All right. So I hope that gives you a better kind of overview of what types of techniques are out there, what they're useful for, how they're used, and why they're used. The whole goal for this episode was to help you understand better on what you may or may not see in a chiropractic office and why we're using those particular techniques. Ultimately, the idea is that we have lots of different tools at our disposal, and we are happy to use whatever is the most effective. That wraps up another episode of Chiropractically Speaking, the podcast. I'm your host, Dr. Prathap Addageethala, and it was an absolute pleasure sharing a few of the techniques that we use in our clinics every day. Hopefully you gained something out of it. And if something resonated with you or something sounded valuable and you wanted to share, definitely do that. Like and subscribe as well. Leave us some comments if you have some questions. We'd be happy to answer them at any time. The next episode is our last episode of the season. We're super excited to wrap our first ever season of Chiropractically Speaking. Thank you so much for joining me along the way, and look out for that last episode. We're out.